Hi, my name's Holly, and I'm going to go ahead and start the discussion to post for the week. I'm going to use my phone to read the questions. So the first question was to pick three of the skills to talk about and the skills that pertain to effective care coordination. And so, get to that page, I want to read a quote from page 67 in our LAM textbook. Care coordination requires specific skills, especially in the areas of collaboration, interpersonal communication, and teamwork. Skills in these areas allow providers to integrate actions and expertise, negotiate judgment differences through timely transfer of accurate clinical information, and determine the shared roles and priority for patient care as opposed to individual clinical providers. So basically, overall, effective coordination is going to take place with a team of healthcare parties with the patient at the center, and those will become more evident as we go through the skills. The three that I'm going to talk about, the first one, and these can all be found on page 68 in the LAM book. The first one I'm going to talk about is the population health management, abbreviated PMH. Basically, I'm not going to read from the book. I'm just going to give my interpretation of what it is. Basically, this is that patient-centered care team. It's going to require the ability to collaborate effectively and participate in the team dynamic with the patient of the center. So, this skill, you've got to be able to work as a team. You've got to be able to effectively communicate with each other. And you've got to be able to all have the mindset that the individual patient is at the center of all the discussions, all of the treatment plans, all of the discharge planning the community, etc. Next is good interpersonal communication skills. So, this is going to require the utilization of effective communication techniques that are appropriate for the present situation with the patient. In my line of work of psych nursing, conversations are very patient specific to that specific encounter. Not all of our patients are going to be in the mindset to be able to have a rational, reality-oriented conversation every time that you see them. And so, those are kind of extraneous conversations. They're not like the average on what we're talking about here. But in conversations where, the patient is oriented to reality in the present moment, a really good tool is the utilization of motivational interviewing. If you work at Atrium, they are offering free classes. If you go on PeopleLink, you can sign up for them for motivational interviewing, and I took the class last week, and it was really effective. And it's not just geared towards psych patients. It's really geared towards any type of nursing and any type of patient population. Basically, the goal of motivational interviewing is being able to be a supportive, to play a supportive role and help the patient come up with solutions to their problems, not by you offering them solutions, but gauging the conversation into where they can come up with the solutions on their own, because patients are much more, people in general, not just patients, but people are more in general to follow solutions that they come up with, not that they're told, because the patient knows themselves the best, and they know what solutions are going to work for them and what solutions aren't. Obviously, for someone in active psychosis or delirium or anything like that, motivational interviewing is not an achievable task. But basically, for those reality oriented patients, you're really just a supportive, active listening role, and you allow the patients this space and the opportunity to come up with their own solutions. And then 3 is a good education and coaching role. So this is all about, coming up with personalized, individualized patient care interventions, solutions, planning. Um, it needs to be very specific to the patient themselves. You've got to take into account all 5 of the interacting variables to holistically form a care plan for the patient. And not only that's one piece of this skill, but another piece of it goes back to that being able to collaborate with other healthcare disciplines, because we all play, our own part in coming up with an effective, obtainable care plan for our patients. And if you read through the other skills in the book, you see, knowledge of health insurance and benefits, knowledge of community resources. So, as nurses, at least in my experience, as I've gone along, I've picked up a little bit of the health insurance and benefit lingo and stuff like that, and the specific site community resources. However, the social workers are such a good resource for both of those avenues, and I think just overall reading the different skills that it takes to have effective care coordination, it takes all of us. It's not just nursing, it's not just the healthcare providers, it's not just social work. We all play a role, and I see this a lot with my discharge teaching when I'm going over my discharge papers with the patients. Obviously I've got the medications down pat and all of that. However, the follow-up appointments are sometimes difficult because I don't know off the top of my head, which services are specifically for indigent patients, which services accept this type of insurance and not that. That's really social work, and so we really have to collaborate with each other to understand, to be able to educate the patient effectively on the discharge planning. Okay, I'm very out of breath. Number 2, it's about the to err is human. Basically, they want us to consider the error or neglect of the healthcare system not to address issues that are outside the walls of the hospital. And they want us to pull from the food insecurity article and the Code of Ethics, the ANA Code of Ethics for Nursing. So basically, the food insecurity article was a very interesting read. One of the biggest parts in it. Hold on, let me get to that link. So according to Flores and Amiri, in their food insecurity article written in 2019, the effects of food insecurity can include obesity, diabetes, hypertension, low birth weight, depression, anxiety. It can Contributing factors can include being a single parent, having a low socioeconomic status, having 3 or more children, having a low educational background, being a member of a racial or ethnic minority, having disabled household members, being a part of the LGBTQ plus community, being a veteran, being an immigrant. Those are all examples from the article of contributing factors to food insecurity. So the reason that I listed those, and I listed the the possible poor health outcomes that come with food insecurity. It's just to show that it is our responsibility um, as nurses, because ultimately food insecurity can obviously lead to major health issues. But not only that, but we, took an oath to take care of the patient in all 5 interacting variables. And every time that we have an interaction with a patient, we have an opportunity to educate, but not only to educate, but to feel these situations out, to see how we can best help, because there's no point in making a whole discharge care plan, regimen, etc. for if they aren't going to be able to carry it out. And having access to quality food is definitely a big part of that. So not only that, but the code of ethics definitely calls us, says that this is neglect on our part. You see the 2 terms. So it was neglect versus error. I'm going to say this is neglect. I'm going to start out by reading a blurb from Provision 8.1, the ANA Code of Ethics. Health is a universal human right. And as part of those human rights, food security is one of those that's listed. In 8.2, another blurb, all nurses commit to advancing health, welfare, and safety. This nursing commitment reflects the intent to achieve and sustain health as a means to the common good, so that individuals and communities worldwide can develop to their fullest potential and live with dignity. So this is a commitment that we made as nurses. And then just another blurb in 8.2 that reiterates that access to quality food is part of the universal right of humans. Nurses must address the context of health, including social determinants of health such as poverty, access to clean water and clean air, sanitation, human right violations, hunger, nutritionally sound food, education, safe medications, and healthcare disparities. And it also furthers to say that the nurse must lead collaborative partnerships to develop effective public health legislation, policies, projects, and programs that promote, restore health, prevent illness, and alleviate suffering. So, and this is found on page 31 through 32 of the ANA Code of Ethics. Basically, us as nurses not addressing health disparities such as food insecurity, and not giving our patients resources to help combat that is like in the last couple words of that blurb there from Provision 8.2. That's not restoring health, that's not preventing illness, and that's not alleviating suffering if we don't address and give them resources to help combat that health disparity. So I hope you guys have a great week. Thank you.